Hello everyone. Today for my medication presentation, I will be discussing proton pump inhibitors, specifically omeprazole, its uses, side effects, and how we as dietitians can consult those who are taking the medication. Omeprazole is the most common proton pump inhibitor. A lot of people take it. The brand name of omeprazole is Prilosec, so omeprazole is actually the generic name of the drug. So Prilosec itself and omeprazole are available over the counter. I pictured those packaging images here on this slide. You can have a prescription for omeprazole. Some people do have it prescribed by their doctor because at a pharmacy it may be at a lower price if the insurance covers it. The most common use of omeprazole is to treat gastroesophageal reflux disease, or GERD, in adults and children. In adults, it can also be used to treat duodenal ulcers or gastric ulcers, and therefore help the healing of erosive esophagitis. Omeprazole may also be used to prevent or treat heartburn, and it can be used alone or with other medications to treat these symptoms. The typical dosage of omeprazole is 20 to 40 milligrams, depending on the severity of the symptoms you are having. If someone receives omeprazole as a prescription from their doctor, it comes as either a delayed release capsule or packets of delayed release granules for suspension, which means that this can be mixed with water and given by mouth or given through a feeding tube for easier usage. If you buy omeprazole over the counter, so either as omeprazole the generic brand or Prilosec the brand name, it comes as a delayed release tablet to take by mouth. Omeprazole should be taken at least 1 hour before every meal, and it can be prescribed once to 3 times a day depending on the needs and severity of the symptoms or GERD. So the over-the-counter Prilosec specifically is taken every morning for 14 days in a row. After those 14 days, symptoms should subside, but if they do not, they can be repeated not more often than once every 4 months. On this slide,
Proton pump
I have included a
inhibitors.
YouTube clip explaining how proton pump inhibitors work.
The main regulator of acid secretion in gastric parietal cells is hydrogen potassium ATPase pump, more commonly known as proton pump. Hydrogen potassium ATPase enzyme system pumps the proton from parietal cells into the gastric lumen, interchanged with potassium ions, which are transported into parietal cells. Therefore, proton pumps are the main acidifying factor of gastric fluids. Different groups have been developed to diminish gastric acid secretions. Binding of gastrin molecules to their receptors initiates cascades of reactions that result in the activation of proton pumps. Thus, gastrin increases gastric acid secretion. Similarly, acetylcholine enhances the activity of proton pumps. Thus, stimulation of cholinergic receptors increases the acidity of gastric lumen. Binding of histamine 2 molecules to their G-coupled receptors results in the activation of adenylyl cyclase enzyme. The active enzyme, in turn, increases the activity of protein kinase A enzyme, which enhances the proton pump function. As expected, blocking of histamine 2 receptors will reduce proton pump activity and acid secretion. Histamine 2 blockers include ranitidine and famotidine. Conversely, prostaglandin E2 molecules inactivate adenylyl cyclase enzyme. Thus, It decreases the proton pump activity and gastric acid secretion. The main example of prostaglandin agonist is misoprostol. Logically, direct closure of proton pumps will significantly decrease the gastric acid secretion. In fact, proton pump inhibitors group is the most effective suppressor of gastric acid secretion. Proton pump inhibitors include omeprazole and esomeprazole.
When someone is taking omeprazole, there are many other drugs that may interact with omeprazole. So there are a total of about 22 different drugs that can cause a serious interaction, 75 different drugs that may cause moderate interactions, and 52 different drugs that can cause minor interactions. Some of the more severe interactions include those who are on HIV or AIDS preventive medicine. So what omeprazole will do will reduce the plasma levels of those drugs. Omeprazole may also decrease activity of blood thinners such as warfarin and increase systemic exposure of xylostazole. Omeprazole may also increase serum levels of tacrolimus and methotrexate, so this could cause toxicity. It is best for those people on omeprazole or any other drug to talk to their doctor and let their doctor know what other medications they're currently taking. Not many drug-nutrient interactions have been identified with omeprazole, but long-term treatment has been proven to alter the absorption of calcium, folic acid, vitamin C, and vitamin B12. The drug herbal interactions include St. John's wort. So St. John's wort can increase how quickly the body breaks down omeprazole, so therefore the omeprazole will not work as well. The most common side effects of omeprazole include constipation, gas, nausea, diarrhea, vomiting, and headache. Because these are common side effects, someone who is taking omeprazole shouldn't necessarily be worried if they experience these side effects, but if they do persist, they should seek medical attention. Some of the more severe side effects that can happen if someone is taking omeprazole include rash, hives, itching, swelling, difficulty breathing or swallowing, hoarseness, irregular heartbeat, excessive tiredness, dizziness, lightheadedness, muscle spasms, jitteriness, seizures, joint pain, decreased urination, uncontrollable shaking, severe diarrhea, and blood in the urine. So if someone who is taking omeprazole sees these symptoms, they should immediately seek medical attention. As a dietitian, if you are consulting someone that is currently taking omeprazole, it is important to let them know that they should be avoiding triggering foods, so foods that may flare up GERD or cause heartburn. And also, if you have a patient that has been on omeprazole for a prolonged period of time, they should be aware that they should be replenishing those depleted nutrients, so calcium, folic acid, vitamin C, and vitamin B12. Because omeprazole doesn't really alter digestion at all, there is not much other advice that a dietitian can give someone other than to continue following their regular diet.